will you teach us something about how you approach desire, how you approach arousal, and how you approach orgasm? Because I'm guessing, like, when someone comes to you, they're not going to distinguish which of those necessarily is the issue, or maybe they will.
Yeah, so the key in any sexual medicine consult is time, spending time with people, and a really good history, right? The physical exam is very, very important because your body tells a story as well. Your tissue tells a story. Where the pain is tells a story. Where the pain isn't tells a story. But first and foremost, the history is everything. And my history isn't just, when we went to med school, right? It was, if you were lucky, you got about a 20-minute lecture on how to take a sexual history. And it was, do you smoke? Do you drink? Do you do drugs? Do you have sex? Men, women, or both? And that's it. Like, sex is a vice. It goes in the, do you drink? Do you smoke? Do you have sex? Because that's not good for you. None of those things are good for you, which is insane because everybody has sex with themselves, with other people. That's how humans are made. Like, it's a really strange concept, right? So you have to take a really good sexual history. And so what does that mean? It means people tell me their story uninterrupted for quite a long time of, I am here today because, right? What brought you to see a sex doctor, right? I just tell me your story. Then I ask about their medical history, their surgical history, what medications they take. I ask them about what they do for work, what they do for fun. I ask them about family history of problems. And then I get into the nitty gritty. It's only then, and that's a long time that goes by. And then I get into the nitty gritty and I go step by step. Tell me about your libido, and I describe it for them if they need help. Tell me about your orgasm. Can you orgasm? Do you have any complaints about orgasm? Has anyone ever asked you if you can have an orgasm? I ask them about their arousal, the lubrication, the engorgement, the erections, the quality, what happens, when do they work? Do they work, do your erections, do you get morning erections? Do they work when you're by yourself and they not work with your partner? I'll even ask people about their masturbation techniques. Nobody asks about that because it matters, right? I see men all the time where they say, I can't have an orgasm inside my partner, my female partner. Well, how do you masturbate? Well, I have to masturbate in this very specific position and this very specific way, rubbing up against this it is not really congruent to like having sex. So if you don't ask those questions, you'll miss it, right? You'll miss the story. I ask, of course, about cultural issues and religious issues and trauma issues, right? Trauma is the huge elephant in the room. So many people, and trauma is just, you have to be comfortable sharing it with me. And I find patients, it takes time sometimes, right? So I keep the door open to some of those issues. And so I ask about back problems and urinary symptoms. And I ask about childhood. Like, I ask about questions that no doctor really ever asks about. And I can only do that by taking time with people. So a consult with me, if you're in my office, is if you're going to get examined, it's an hour and a half, right? And even that, I find sometimes when you come with 30 years of pelvic pain is not enough time, right? And so it really, you have to understand this, the way medicine currently works with these 10-minute visits and this $40 copay and this, like, it does not work for these types of problems. And so I can't, and in fact, I couldn't get a job when I got out of fellowship at a big university because they said, ooh, you won't make us enough money. What you do doesn't get reimbursed by insurance companies, so we can't hire you. What you do is a little weird, Dr. Rubin. So I had to kind of be forced to kind of be an entrepreneur and do my own thing, which thank goodness, has been lovely.